This is a demonstration of the semi-automated meniscus segmentation method developed at the Ohio State University Department of Biomedical Informatics. We'll begin this demonstration by loading a patient. This is a list of patients used in the study, and we'll pick one. And these images are T2 weighted MRIs of the knee, which are sagittal, beginning lateral to medial. So to give you landmarks, here's the head of the femur, surrounded by its articular cartilage here in gray. This is the tibia with its articular cartilage and fibula. Here's the front of the knee, and here's the posterior. In this dark area in between the bones is the lateral meniscus, which is going to be our target of segmentation today. If we scan through, we can see how the meniscus tracks and then stops at the cruciate ligaments and then picks up as the medial meniscus. We're going to focus on segmenting the lateral meniscus today. And this segmentation method was developed to enhance speed and consistency as opposed to manual segmentations. Manual segmentations are prone to inter and intra-reader variability, which can be reduced using computer-assisted algorithms because of their consistency. So we'll begin the method by finding the first slice that the lateral meniscus appears. So if we'll track through lateral to medial, we see meniscus first appears on slice 6. Another manual input required is the last slice that the meniscus appears. So we're going to continue tracking through the slices until we come across the cruciate ligaments, indicating that the meniscus is stopped. So here are the cruciate ligaments. You can see that slice 13 is the last slice that shows meniscus. Now returning to our first chosen slice, slice 6, we need to identify a seed point. This point indicates to the algorithm where in the image that the meniscus is located and begins its region growing method. In this case, we chose seed point 222 and 236. So these are the only required manual inputs, and the rest is done automatically. So we'll segment the meniscus. The green outline are the results of the segmentations. Just as the meniscus tracks through the images, the segmentations follow. This algorithm works based on intensity restrictions to eliminate cartilage and range restrictions to try and identify the border between meniscus and cartilage. It also uses region growing approaches and post-processing methods to identify meniscus as opposed to cartilage and bone. Some of the uses for this algorithm could be to track osteoarthritis structural changes with osteoarthritis clinical symptoms. The meniscus has been shown to have a role in biomechanics of the knee joint, and removal or injury of the meniscus predisposes to early onset of osteoarthritis. Segmentations are the first step to being able to extract volume, intensity distribution statistics, and texture analysis to find a potential biomarker for osteoarthritis.